Hi there. My name is Gayatri Devi, and I'm founder and director of Park Avenue Neurology in New York City. And today I wanted to talk to you about a very common symptom that is found in people who have concussions, and that is vertigo. Vertigo doesn't have to present with a classic spinning sensation. It can also just be a sense of imbalance. It can be a feeling of nausea. It can be unsteady gait. And sometimes my patients with vertigo, post-concussive vertigo, will have trouble reading, they'll have trouble concentrating, they'll get headaches that are persistent, they'll feel unsteady or their balance is off when they walk or they move. And vertigo can persist for months and even years after head injury. Usually, the cause is when you have trauma to the head, inside your inner ear, you have small hair cells, and perched on the hair cells are these calcium carbonate crystals. And the crystals, the calcium carbonate crystals or otoliths, are dislodged and then they rattle around. And so, even a slight movement of your head causes those otoliths to rattle around on the basement membrane of your inner ear, and it sends a impulse into your brain to convey a sensation of movement even though you aren't moving. And that's what causes the sensation of vertigo, where there's a discordance between what your eyes and your body is telling you and what your inner ear is telling your brain. I find that anywhere from 30 to as many as 65% of patients with trauma, which can be slight trauma to significant trauma, so soccer injuries, concussions from horseback riding falls, can cause vertigo. And there's a very simple treatment for it. If it's post-concussive vertigo, a very common cause, as I say, of post-concussive vertigo, there are a couple of other causes as well, but we're not going to discuss that. A very common cause is this dislodging of the calcium carbonate otoliths inside your inner ear. And all you need to have done then is something called an Epley, or an otolith repositioning maneuver, which takes a few minutes by a skilled clinician, and sometimes that could be your physical therapist. Anybody can really be trained to do the Epley procedure, and once it's done well, the vertigo resolves. I once had a patient who was a 9-year-old girl who had got hit while sailing on. She got hit in her head while sailing with the mast of her sailboat, and passed out. And then after she recovered, she had headaches. Then they resolved, but she continued to have severe symptoms of trouble concentrating when she looked at flat screen TVs, when she tried to do homework, when she tried to do homework on her computer, she would have problems. And it turned out that the reason was vertigo. And we just did an Epley procedure in the office, which again takes about 10 minutes. And thereafter, her symptoms resolved. But she had to endure nearly 3 months of suffering, both from headaches, trouble concentration, depression because she didn't know what was going on, and this sense of nausea, imbalance, that was the result of this very simple problem. And there's a simple treatment for it. So if you have concussion and you have post-concussive problems that resemble what I have just delineated, then you may want to speak to your physician about having an Epley procedure done. I hope that's helpful to you. It's been very helpful to many of my patients, and I think it's a simple, underutilized tool that can significantly improve quality of life in patients who've had head injury. Thank you very much.